Seems like every day we have more questions about the pandemic. Infectious disease expert Dr. Robert Citronberg from Advocate Aurora Health is here to answer some of them this morning. Doctor, good morning.
Good morning, Terrell.
Now, when or how would we find out if Lollapalooza led to some kind of outbreak?
Well, we know the incubation period, which is the time between exposure to the virus and the time that symptoms develop, is usually between 4 and 5 days on average. It can go up to 14, but almost everybody who's going to get infected gets infected by 10 or 11 days. So it started on Thursday. Next couple of days, you could potentially start to see cases. I think by next weekend, we'll probably be having a pretty good idea about how much transmission occurred because of Lollapalooza.
Mayor Lightfoot has said that if cases continue to rise, we could see new restrictions in Chicago. What kind of restrictions do you think are likely?
It's hard to say. I think they're probably going to bring back masking for the whole city, perhaps social distancing, capacity requirements. I think it's very unlikely and very unwise to have any sort of lockdowns or shutdowns in the city. That wouldn't really make any sense. But I think it's possible we'll see masking and particularly reductions in capacity.
And doctor, you've said that the vaccinations are the key to ending this pandemic. Is there some encouraging news on that?
There sure is, Terrell. We've now started to see in the last couple of weeks a significant uptick in vaccinations, particularly in states that have low vaccination rates, places like Arkansas, Missouri, Mississippi. And I think what's happening is a lot of people are believe it or not, starting to get scared because they are seeing people in their communities getting sick and dying from COVID. Fear is a great motivator, and I think we're really going to see the next couple of weeks a big uptick in the number of vaccines that we're giving around the country.
Well, we certainly hope so. Dr. Robert Citronberg, thank you so much for your time this morning.